Has your child been vaccinated? If your child has not been vaccinated, please ensure that that child is vaccinated, and it should be optimal to the right age. A child who is not vaccinated is like when you build a house without a fence. Anybody can jump into your house. But when you have a fence, it takes the person a long time to climb that fence before they get to you, and then you would have prepared yourself. So if your child is not vaccinated, your child has no defense, has no protection at all. And that's what we are trying to do by advising the mothers to vaccinate their children to get enough protection, enough defense, so that they don't fall sick with any of the vaccine preventable infections.
Thank you, ma'am. So vaccines are safe.
Very safe.
Fantastic. Good day, ma.
Good day.
Welcome to the LUTH Podcast.
Thank you.
So before we get into today's topic, can you tell us what your name is, what you do, and how this affects children with diphtheria?
My name is Dr. Akintan. I'm a pediatrician, and I have a soft specialization in pediatric infectious diseases. I enjoy taking care of children. Seeing a child who is ill today and well tomorrow is very dramatic, and that puts a lot of joy in the heart of the parents, also in my own heart. So I want to help children to get well.
Nice, ma. That's really what medicine is all about, making people feel better. Ma, if there was one thing that you would tell people to do that would make them feel better in general, what would it be?
If I would tell people if there is a vaccine for any illness or any infection, you should go get it, because it's been shown that that is one of the most cost-effective interventions in human history. If there is a vaccine for a disease, for a sickness, for an infection, if it's available, try to get yourself vaccinated, because prevention is always cheaper and better than a cure.
But there are some cases where people are afraid that things will get worse if they take those vaccines. What can you say to them, ma?
Those are a lot of myths and misinformation people hear from spaces, read online, or from friends, from people who don't have enough information. We have a lot of low literacy in regards to vaccination. People don't know a lot about vaccines. A lot of the things we say are in language they don't understand. So those informations needs to be corrected. And we'll have to correct it by telling them in simple languages, in their own native dialect, where they can understand, and get people who are influencers in those communities to speak to them about those interventions, be it vaccine, whatever it is, so that they can understand that these are our people. They can't do us harm by telling us to do something. If you bring a community leader and make him speak about something in his community, the community is going to follow him, because they know that this is our chief or this is our leader. Is not likely to tell us to do something that will harm us. So when someone who is not, they are not used to talk about it, they don't believe you, and there are a lot of negative information in the social media that people listen to. They don't listen to the truth. So those informations are what they hold on to, and that's why they don't do what they need to do.
You mentioned the influencers, and we have some prominent ones currently, I think, on some social media platforms, and I think they're doing really well. I myself, I might also get into influencing in the health space though, so that we can have more people taking vaccinations and seeking healthcare. So, ma'am, let's get into the topic. What is diphtheria?
Diphtheria is a childhood killer disease. It's been there. We after a while it was suppressed. We didn't see much of diphtheria with us, but recently it's back again, and it doesn't seem to be going anywhere soon.
But why is it dangerous, especially in children?
Yeah, because in children, like I said, it's a killer disease that affects children, and a lot of children, if they don't get intervention early, the children don't survive it. So we need to identify it on time and let people get treated. In fact, prevent it if possible. You don't want any child to have diphtheria. That's the way we should go.
We'll come back to that prevention. But now you mentioned early detection. What can we see? What are the signs and symptoms parents can look out for to make sure they catch it early?
Diphtheria presents like any other common disease that we see. They will have a fever, they will have a sore throat, They'll have difficulty with swallowing, so the child refuses to eat, and the mother is wondering why the child is not eating. They have difficulty in breathing. Sometimes there will be a change in their voice. They might have a very thick catarrh draining out of their nostrils. They might have a wound on the leg that looks like a wound. They have difficulty in breathing. As it gets worse, they develop difficulty in breathing and they are unable to breathe. And that's the stage where a lot of mothers get concerned. And they can have the swelling of their neck, which is called a bull's neck. It looks like the neck is swollen. So that's the parents get alarmed when they see that, and that's when they come. And unfortunately, that stage is not a good stage to come to the office. It's already getting very, very late. And this germ or this bug produces toxins in the body that goes to attack the heart of the child and also the kidneys of the children. So it knocks their kidneys off, take over their hearts. Their hearts are not beating well like it should. So that's where the major problem for them is. And it has a very high mortality. What we mean by mortality is, if you have a group of people, 10 out of 10, how many of them are going to survive? How many of them are going to die? That's mortality. Mortality for diphtheria is, even in the best of centers, is very, very high. So they need to come to the hospital early.
Their hearts and their kidneys, that really shows that it's a killer disease.
Yes, it is.
So how quickly does it progress?
Unfortunately, it progresses rapidly. In 2 to 5 days, it can actually be very, very devastating. So a lot of people come to the hospital and they tell you they just noticed it 3 days ago. So in an outbreak situation, a child who has a fever and a sore throat, you must see a healthcare facility and let the throat of that child be examined and be checked.
What's in an instance where there is no outbreak, but your child has these symptoms?
Any child that has a sore throat should be checked, because it might not be diphtheria, it might be something else that is also devastating as well.
So people should seek.
Yes, seek help. When you have any child with sore throat and a fever, should seek help. Don't try to treat them yourself. Let somebody who has more experience in taking care of children look after those. Check that child.
Well, some people are afraid of coming to the hospitals because they believe their symptoms will not be attended to. What do you think about that?
We have healthcare centers everywhere. In Lagos, you can go to a healthcare center. If the healthcare personnel there is not capable, or you think she can't handle or he can't handle, you send you to the higher level health facility. That's the way to go. So there's always a health center close to people around them. It might be a private facility, it might be a primary healthcare center. Wherever that is close to you, let somebody who has experience look into the throat of that child.
So we shouldn't promote self-medication.
No. First medication is not the best for anybody.
In some cases, it might even make your disease worse. It might aggravate the disease.
Especially if you take the wrong treatment.
Yes, like antibiotics, for example.
Which you shouldn't take on your own without prescription, because the day you need it, it's not going to work for you.
Why do you think, recently we've been seeing cases, outbreaks in school. Why do you think this disease is coming back all of a sudden?
I think there are 3 major reasons why we're having it back. Now, we have what they call the primary vaccines. When a child is born, there is a series of vaccines they get. Children should get that. A lot of our children don't have that. There's a term called the zero-dose children. Nigeria has the largest number of zero-dose children. There are about 2 million children in Nigeria that have never had any vaccination. Never. They've never had a vaccine. Some of them didn't even get the primary vaccines complete. They got some and stopped. Then if you vaccinate a child, right? If you vaccinate a child, some vaccines you take once and it covers you for a lifetime. But there are some that do not cover you for a lifetime. So you need to give the child what they call a booster, like extra one, right? That's what a booster is. So diphtheria, unfortunately, falls into those group of vaccines where you need a booster. So if you immunize a child in infancy with the 3 primary doses and give a booster at 18 months, it's probably going to last for that child till like 4-7 years. So around that period, that child is meant to get a booster. If you give at 4 to 7 years, in another 5, around 10 years and above, you should give a booster. The truth of the matter is that vaccination never ends in life. You can't say, I've completed my vaccination. If an outbreak of something comes now and we need to be vaccinated, even adults, we all need to be vaccinated. So those are the issues we have. People are not getting their primary vaccines, they don't get at all, or they don't complete it and they don't get booster doses. That's why we're having this outbreak now.
Well, you mentioned that we need to get it, or vaccination happens throughout life. What are those that are afraid of needles? They should just endure.
Well, the needles for the vaccines are very tiny needles. They are not really the big needles.
Okay, so
So
no
for
pain.
children, the healthcare workers try to give them the tiniest needle as much as possible. I know children are generally very scared
Yes, ma'am.
of injections.
So schools, why are schools such a hotspot for these outbreaks, especially in Lagos?
It's everywhere, not just in Lagos, anywhere. When you have a group of people crowding together in a place, so many people crowding together in a place, that makes they interact together. If you stay together for 8 hours, you'd have interacted a lot. So you share a lot of things, the good, the bad, the ugly, right? So if you have an infection, they share with their friends. Children don't know boundaries. They share cups, they share spoons, they share everything, and they are in the same environment, breathing the same air. And the diphtheria is transmitted in the air is what they call a droplet. When somebody coughs or sneezes or secretion from the person. That's why the children get it, because they are together in a place. It's not just anybody, it can be in an office, right? It can be any regiment, any facility where they stay together. They stay together, and especially if it's not properly ventilated, then it spreads very, very fast.
But what can schools do to combat this?
One is prevention. If you have a child that wants to enroll in your school, just politely ask the parents to show you the immunization card. Just have a look. And I believe most schools have nurses or a head bay or somewhere where somebody checks and check if this child has been immunized. That's a good way to start. And if the child has not been immunized, you can talk to the parents to go to the nearest facilities and go and vaccinate the child. Sometimes they even come to school to vaccinate people in the school for certain illnesses. So you check if the child has been vaccinated. And if the child has not been vaccinated, then encourage them to go vaccinate and check if they actually got it. Then secondly, if you have have children in a classroom, make sure the place is well ventilated. In the dormitories, well ventilated. Children like to lock up their windows because they are scared of something from coming in to jumping in the room. They are scared, so sometimes they lock up themselves in a dormitory, and the child has diphtheria and the whole place is congested. It's going to spread very fast.
So you mentioned vaccine cards. What if a person can't find their card, or the parents can't find the cards of their children, or they never even got the cards?
It is almost impossible to get vaccinated without getting a card in Nigeria. That doesn't happen. If they don't have a card and they can't remember, the best thing is to assume the child has not been vaccinated. That's the only evidence, and vaccinate that child. It's never an overdose. If they don't have a card, there is no proof, I will err on the side of caution and immunize that child, rather than assume that the child got vaccine when he didn't, because you can't prove it.
Yes, ma'am. Prevention is always better than cure. So since you said there is no negative side effect of taking the vaccine again, right?
Yeah, if I have a child who have no proof that has been vaccinated, the ideal thing is to vaccinate that child, because you'll be liable if the child gets the infection, because you have no proof. The mother can't remember what she got. Another thing you can write to the health facility. They have record. If they have record, they'll tell you this child has been vaccinated. But where none of those things exist, then you can as well assume that the child never got it, because you have no evidence to show.
Yes, ma'am. So in boarding schools, you mentioned dormitories. At what point should the school suspect that diphtheria is already occurring and then escalate to maybe tertiary hospitals?
A lot of times, because it depends on the level of the health personnel that's in the school. A lot of times they don't suspect it. It's when they start having a bull's neck that they begin to, oh, this is diphtheria. So in an outbreak situation, we have a child who has a sore throat. Please look into that throat. If you are not comfortable with that child, the first thing, send him to a higher healthcare facility where somebody who is experienced with looking after children will look after that child properly and be sure it's not diphtheria. Because it's best to pick diphtheria fast. If you don't get it on time, a lot of the measures don't work. So early detection is key to survival in diphtheria.
Okay, so what if one child has a cold and sore throat? Should the school suspect just from that single child?
Yeah, you can take the child to a health facility. They can take a throat swab and check. Okay. If it's diphtheria, you are going to know in a day or in 2 or 3 days. If it's not diphtheria, you know. Like I said, diphtheria looks like any other throat infection. If it's not diphtheria, it can be something else which you can handle. But if it's diphtheria, then you need to act fast.
Okay, so we know some parents, whenever they hear that their child might be referred to a tertiary facility like LUTH, they begin to get afraid that their child is going to be isolated. And then they step back, they don't want to continue with the treatment. What do you have to say to them?
For those parents, I would like to say what is most important is the survival of your child. Your child has to be alive first. If you're referring to a tertiary institution, it means that's where they think you can get the best care. And isolating a child, because diphtheria is an infectious illness, that child needs to be kept away from other children. And being put in a tertiary institution in an isolation room might be a single room. What they are trying to do is simply to prevent the spread of that disease. And just by giving you a face mask and keeping your baby away from other children can protect the mother and also protect other children from having the disease. So keep the children away from other children. You can't put the child in an open ward with other children. They are in the acute phase. But once the child has been treated, the child can stay in any other ward when he's well. The next time he comes to the hospital. So it's just for that period, not for the whole length of the child's life, right? So isolation ward, there are people there, there are nurses there, there are healthcare professionals there. The child is not going to be left alone in the room. That's the scare that they lock up my child in one room and I don't see my child and nobody's there. There's always somebody there looking after your child, just for a short period to prevent the spread of the disease.
All right. So we know that, like we've said earlier, it is a vaccine preventable disease. What are some myths? Maybe you've come across parents and they have certain fears. What are some of these fears they have, and what do you usually say to them to, overcome the fears? A
lot of mothers will say that when they give their babies their vaccines, they have a fever, it makes the children sick. Those things are just transient, and I know that healthcare workers usually advise them what to do, counsel them what to do. It's just for a short period. You're giving a child something that, when the child has a fever, I mean, the child is trying to react to something that you have given to show that there's something working in his system. So it's not going to harm the child. A lot of times they get information from wrong sources where they tell them that vaccines will cause this, it will cause infertility, a lot of wrong things that they hear. And that's what the parents tend to stick to. So they don't like to take vaccinations.
Now, if there's one message you could leave to parents, policymakers, general public, what would it be?
I would say we should make vaccines available to every child. If you are a parent, has your child been fully vaccinated? Is your child immunized against all the common killer diseases? If you are a school owner or you interact with children, you have a group of children that you take care of, is your environment well ventilated? Are those children immunized? So vaccines must be available to children. Children must get vaccines. It's their right to be vaccinated. They have a right to life.
They have a right to life, truly. Now, before we end the episode, we would like to do a quick rapid fire game where I'll say some things and then you let me know if they are true or if they are trash, meaning if they are false. So first, diphtheria is a disease of the past and is no longer relevant.
It's trash.
A sore throat in a child should always be taken seriously during an outbreak.
True.
Only children who are not vaccinated can get diphtheria.
Trash.
Thank you so much, Ma, for sharing your experience with us. Conversations like this help us move from fear to understanding and from understanding to action. Thank you to the audience for tuning in to today's episode. See you next time.